Hi, I'm Spencer McCombs with McCombs and Associates Physical Therapy. One of the main things that we treat here in physical therapy is shoulder pain. So often our patients with shoulder pain, whether it's chronic or acute, may believe that surgery is the only thing that will fix it. Well, in more cases than not, oftentimes just strengthening the muscles around the shoulder, releasing tight muscles and improving joint mobility in the shoulder is enough to fix shoulder pain to where people can go on functioning with life and not have to have painful shoulder surgery. So I'm going to show you some of the techniques we use here in physical therapy to help get the shoulder back to normal. So first is soft tissue mobilization. So oftentimes when people have chronic shoulder pain, the muscles above the shoulder and behind the shoulder will get really tight. So we spend quite a bit of time just relaxing and releasing those muscles to help the pain in the shoulder so they can start to use their arm again. So here I'm working on the upper trapezius muscle, the levator scap, and just releasing that, doing some deep massage to help relax all those muscles through there. And then to get down through the back of the shoulder blade, we work just right through here, relaxing and releasing the rhomboids, the paraspinals, the middle and lower trap, any muscles that might be holding that shoulder blade to where it's not moving properly, and we just get it moving. And then also here on the outside of the shoulder, we'll work this area as well. So these are all the scapular muscles, the shoulder blade muscles, that can really tighten up in people that have more of a chronic type shoulder pain. Okay, so after we relax the muscles and get the patient feeling better, then we start some stretching. So if you'll go ahead and line your back for me. Now I'm going to demonstrate some of the shoulder stretches that we do. Go ahead and come this way for me. Perfect. All right, so these stretches are very gentle and very easy. These are really good for people that have rotator cuff tears, that have arthritis, have frozen shoulder or impingement, because so often all these conditions are caused by poor shoulder movement. And so these techniques aim to get the shoulder moving more properly. So this is called shoulder flexion, and this helps so your patients can reach up and overhead. And these are all called manual therapy techniques. And after we do all this stretching, we're going to follow up with some strengthening exercises and some stretches that patients can do on their own at home. Okay, so we stretch into that direction, and I'm just doing an abbreviated version right now. And then we're going to work into out to the side. So this is called abduction, to where patients can reach sideways, like if you're going to Sonic and want to slide your card in the slot. That's a difficult motion for people with shoulder pain. And then here I can also do a joint mobilization, to where I'm stretching the joint downwards to help to loosen up the joint so they can reach up to the side better. And that's very, very common what we do. So you can see a little bit about the hands-on techniques that we do here. And like I said, we would follow up with some very specific rotator cuff strengthening exercises and some scapular stabilization to help patients get their normal function back. So we'd love to see you come by McCombs and Associates Physical Therapy or Level End Physical Therapy if you have shoulder pain or problems, and we'll let you know what we can do to fix you. Thanks so much.